So in our area we have a community data warehouse where we pull in data from GP practices and the acute hospitals. So we're using that as a really rich data source to be able to do sort of dashboards, to be able to actually monitor various metrics, but also we're going on to another level of doing more data science on the data set that we've got. So particularly for this project, for the serious mental illness patients, we're looking at can we use the data we've got to predict who may have depression or anxiety or an SMI that we don't know about yet, and actually then taking that a step further, can we predict who may be at risk of exacerbating, so either attempted suicide or turning up at ED with a crisis point. So can we use the data to try and predict those patients so we can do targeted population health before the event. So the data is really important because it's not just dry data that doesn't mean anything, it's actually helping tell a story about individual patients. So it allows us to look at a patient not just as just a person, but actually all of the things that have happened to them in the past, so we can help with that individual to sort of tailor interventions in the future, to tailor the pathway they're on, and also at a larger level we can do more population health interventions about particular cohorts. So the benefits will be that rather than just you go to your doctor when you're ill or you end up in an ambulance if you have an accident, we'll be able to actually target those patients before these sort of events happen. So if we can look at particular cohorts of patient, whether it's obesity or deprivation of where you live, if we can find that you're in a cohort that's more likely to attend ED in the next year or to have particular problems, maybe a stroke, if we can predict that, we can actually help those patients not have those events.